You've been told that you have a disc herniation. Here is something that you need to understand. Most of them are going to shrink and resorb on their own. Just sit with that for a sec. There's no surgery, there's no special fix. Your body is going to handle the herniated disc. There's always a caveat. We'll get to that. In 2024, they did a big systemic review about disc herniations in the lumbar spine and found 76% of them will completely resorb over time. And your body is not passive in this process. It is actively trying to heal the herniation as soon as it happens. Your immune response dictates this. There's a recognition of material in the body somewhere where it doesn't belong. So the response is triggered to break it down and clear it out and repair. And this isn't some theory, this is the biological process of the body when there's an injury to a disc. So if that's happening, why are so many people still stuck believing that their life is over or they're never going to be able to do things again if somebody tells them they have a disc herniation? It's not the disc that keeps them stuck. It's what happens after they're given the diagnosis and how the diagnosis is presented to them. Language matters a lot. If you're told you have a disc herniation and the next things that that person says to you are along these lines: don't bend anymore, no more lifting for you, you need to be careful, avoid any pain, then what are you going to do? You're going to stop moving. You're going to stop trying. And now what ends up happening is you have less strength, you have less tolerance, you have more sensitivity, and you're more afraid of doing things that used to be routine. And that's the things that keep the pain from resolving. Your decrease in strength, your decrease in tolerance, your increase in sensitivity, and your fear. The pain isn't just about the disc. It's about how your whole system is responding to the diagnosis. And what ends up helping people this is where people get stuck. There isn't a perfect exercise that helps. There isn't some special techniques, no matter what any doctor, physical therapist, chiropractor tells you. Avoiding movement doesn't work. What works is staying active. What works is moving in ways that are tolerable, easily progressive, and can be done consistently. That's what works. The body will take the time to heal. But if you remove those things, you're not going to get where you want to be. And the other place people get stuck is you don't need to have complete elimination of pain to start moving forward. You just need to reduce how much threat you feel about the injury and then build back your capacities slowly and progressively. The body is going to heal the best when you keep using it and you give it the proper environment to heal. So there are some very few instances where surgery is going to be the right call on a disc injury. If there's severe compression of a nerve that's leading to decreased motor function or atrophy of muscles, that needs to be taken care of sooner rather than later. If a person loses control of their bowel and bladder function, that needs to be taken care of. Those situations, surgery is going to be indicated. But that is not most people that get a disc herniation. So that matters. So you can't let somebody scare you and talk you into doing something that's not necessary. And the one thing that most people never hear is that the disc heals. Most people are never told that. Unfortunately, there are some people out there where an MRI is done later, disc shows complete healing and resorption, and they still have some pain. And it's not because the disc wasn't fixed, it's because their whole system is still sensitive. And that goes back to these other things I discussed about what they're told to do and not to do, and how fearful the provider has made them about their disc injury. There's going to be the sensitivity remaining if they've been avoiding doing anything. So the nervous system, movement patterns, fear, deconditioning, that's what's going to keep the pain sticking around. So if you're just sitting there thinking, man, I need to get this disc fixed before I can move, you have everything backwards. You need to move so your body can adapt. And then while your body heals, you need to keep doing things in a tolerable way, because that's what it needs to do to heal. You're not waiting for the disc to completely resorb before you get back to anything. You are part of the process. It's going to happen either way, but you need to stay active. So if you want a clear way to work on this, go to my profile, load your spine, grab a copy, get to work.